Today's Wednesday Wisdom is part 4 of our Essential Stretching series. In this, we're going to look at really the upper extremity. So we're going to look at the anterior scalene and bicep, how to effectively stretch these guys. But remember, this is part of our longer series, so be sure and check out the other clips. Scalenes are 3 muscles in the side of the neck that are primarily used for side bending, but they're also involved in rotation. And when they get tight, they can really compress our cervical spine. Of the 3 scalene muscles, the one to the front, the anterior scalene, it tends to be the tightest, and it's the one we're going to focus on. So to do this, we want to first of all make sure that we're not just lifting our ribs and losing the effect of our stretch. So I'm going to ask Alison to reach over, grip the sidebar of the chair. She's going to bring her shoulder back and down and then lean away. So this uses the shoulder girdle to really hold down the first rib or two. Now to stretch anterior scalene, we're going to do a 2-part movement. To stretch the right side, Ali's going to turn her head right to about 45 degrees and then tilt left, holding for just 2 seconds and then easing back. So each time we rotate, side bend, we should be feeling this slightly to the side and the front of the neck. Here we're using the left side muscles to contract, which will have a reciprocal effect and help the right side muscles to relax. If we want to deepen the stretch, an advanced stage of this exercise is we can use the fingers of the other hand to create a little bit of additional draw. So you're going to bring up the other hand, Ali, hand against the temple, and this is more of a lifting action than a levering. We're not pulling strongly to the other side, we're more pulling up towards the ceiling. So we're drawing in this direction, and this does add a deeper stretch. We're going to do this 10 times, so 2-second holds. You can either count to 20 going 1, 2, or you can count individual times you perform the movement, individual reps. That's looking good. Okay, how many is that? 10, and relax. Okay, let's repeat that to the other side. So now Alison's going to grip with her left hand. She's going to reach over to grip the bar in the chair, bring the shoulder back and down. So we're really levering, using the shoulder girdle to keep those first and second ribs down where those scalene muscles are connecting onto. So now to stretch her left side anterior scalene, Ali's going to rotate left to 45 and then side bend to the right. 2 seconds and relax. So rotating 45, leaning to the side and relax. So that's 2 reps. We're going to go on to our 3rd rep. And again, Ali, you can deepen the stretch if you want by using the other hand. So when you rotate, side bend, this hand is going to come up and just lift at the temple, drawing towards the ceiling or towards the corner of the room rather than pulling down towards the right shoulder. Because we don't want to create compression, we want to create length in the target muscle, in the left side anterior scalene in this case. 2-second holds so that we don't create any ischemia, we don't irritate nerve endings. And using the opposing muscle so that we get a nice strong reciprocal inhibition so that our target muscle is actually relaxing and stretching because the muscles that are being asked to perform the movement are tensing and contracting. That, as we said, is the law of reciprocation because muscles work in a give and take. Good, and like I said, 10 reps is a good average. If you want to do more, if you want to do 15, that's fine. You can do 15 reps. It would be equivalent to doing a 30-second stretch, where 10 repetitions is like doing a 20-second stretch. That's great. Thanks, Ali. The biceps, or to give it its full name, the bicep brachii, is really an underrated muscle for its contribution to shoulder pain. So if you're getting any kind of pain or pinching around the shoulder, any kind of pinching sensation when you bring your arm out from your body, or limited range of motion, if you're in the gym and you're doing a lot of pressing motions, then this is an important stretch for you. If you're sitting at a desk or you're on your device a lot, that is equally going to make this a really important stretch. So for this one, the common dysfunction that we see is a forward shoulder posture. And the tendency that people have when they try to stretch their bicep is to let the shoulder roll forward. So we're going to actually use the back of the chair and we're going to use the opposite hand to really try and keep this shoulder blade back and down. So to begin with, Ali, I'm going to ask you to bring the shoulder back and down, lean it against the chair and bring the other hand over so that we can monitor. You don't want to feel this shoulder cap push forward. With the palm towards your side, you're going to reach back just as far as is comfortable without letting that shoulder go for 2 seconds and relax. So if you count reps, Ali, this is our 2nd rep now. Good, and relax. Reaching back, good, and relax. Let the arm relax fully. Reach back, good. Monitoring that shoulder. It's very easy to let it start rolling forward. If you feel the shoulder is rolling forward, just reset between repetitions. Bring the shoulder back and down again, monitor from the front, and reach back. Good, keeping that shoulder blade stable. Good, back and down. See how easy that is? That we're so ingrained in letting the shoulder roll forward to compensate for the loss of movement because our bicep is tight. Let's take a look at this on the opposite arm then. So once again, we're going to bring the shoulder blade back and down, keeping it in place, using the back of the chair to hold the bottom edge of the shoulder blade, using our serratus anterior muscles and using our opposite hand as a monitor. Palm is towards our side and we're going to reach back. 1, 2, and relax. Really keeping that shoulder pinned in place. Reach back. Good. This is our second repetition. So Ali, counting in your head, you guys, if you're practicing along, counting in your own head, and remember we said you've got a choice. You can either do 10 or you can even do 15 reps or more if you wish. Unlike strengthening, it's hard to overdo it with stretching. The only thing we want to be cautious of is that we're not stretching weak muscles. In this series, we're looking entirely at muscles that tend to be tight. So they benefit the most from stretching. Good. Keeping that shoulder back and down, reach back. Good. I'm just monitoring here. I'm not limiting Alison's range of motion. I'm just checking to make sure she's keeping the shoulder blade in place. So normally just using the back of the chair and using your fingers will be enough to stop that shoulder from rolling forward. Because the typical pattern we see, which is not giving us a proper bicep stretch, is as we reach back, the shoulder rolls forward. We get much greater range of motion, we can reach much further, but we're not actually lengthening the bicep. Instead, we're destabilizing the scapula. That's great, thanks Ali. So try out those 2 great stretches and let us know in the comments how you got on. And then remember, we have our longer video on YouTube. We'll put a link in the description. And also, this is from our Essential 8 therapy series. So if you're a massage therapist and want to know more about how to treat these conditions, check out, there'll be a second link in those comments or in the description. Thanks for watching. We'll see you guys again soon.